So in this class we are going to see on the details of axillary region. So in pectoral region we had covered two important topics such as mammary gland and about pectoral region. Now we will move on to another important topic which is seen in pectoral part, in the upper limb part, that is axilla. So axilla, it is a region which is present between the upper part of the arm and the lateral thoracic wall. You can make out here, which is otherwise known as armpit. You might be heard in your day-to-day life. Armpit is nothing but axilla region. So armpit, which is present between the upper part of the arm. So this is the arm region. In this part will be called as upper part of the arm, and this region will be called as lateral thoracic wall. So between these two areas you will be having one space. That space will be called as axilla. About the details of this region we will deal later. For orientation, you just go through on the points whatever I'm telling. So we will be having a space present between the upper part of the arm and the lateral thoracic wall. The space we will call as axilla, and this axilla again will be having some more parts because it is shaped such a way that it will be conical in shape. So if a space is conical, it obviously will be having boundaries such as apex, base, anterior wall, posterior wall, medial and lateral wall. So these are the 6 parts we are going to see detailing in axilla. So these are the parts which are present in axilla, and more important, we have to see the space with its contents. So before moving on to the space, first we have to remove other covering areas or covering muscles which is surrounding this axilla region. So in this axilla region, anteriorly you are seeing a muscle called pectoralis major. So if you remove this pectoralis major muscle, you will see another muscle present below the pectoralis major, which we will call as pectoralis minor. So once we will remove pectoralis minor also, you can get a small area here between the arm and the lateral thoracic wall. That area is nothing but axilla. For our easy remembering, we can remove the long head of biceps brachii also. So if you remove biceps brachii, the space and the contents whatever you are seeing are considered as axillary region, and this region will be carrying very important structures which are to be present in this particular region, which we are going to see now. Okay, so now we will move on to the details about this region. So in this region, while you are seeing, you can make out some important vessels seen in this region. So this is the axillary region, which is somewhat triangular in shape or conical in shape. In this you can make out an vein here. So that vein is nothing but right axillary vein. You might have already known the picture. What we are depicting here is right sided human body. So right sided specimen with right axillary vein you are seeing now. So then after, if you are removing right axillary vein which is present in the axilla, you can make out another important structure present there. So that structure will be called as nerve. You can see many yellowish yellowish structures passing through. So those structure is nothing but median nerve. So we'll be having median nerve, or you remember for now we'll be having contents of brachial plexus also will be seen in this axilla region. So vein we have seen and many nerves are passing, those are nothing but branches of brachial plexus. So once you remove this brachial plexus also, what will happen? You can make out other structures, such as if you are removing the muscle thoracobrachialis also from here, and the nerves branches of brachial plexus, you can view important structures seen in the axilla. That is, after axillary vein you are going to see important structure, that is axillary artery. Yeah, right, they will be having axillary artery present here. So you can view here, this is the axillary artery, which is the major content of this axilla region. So axillary artery details also we will see later. So now two major contents you have seen. One is right axillary vein, another one is right axillary artery. Along with this, we will be having many green colored vessels. So those vessels are nothing but lymphatic vessels. So axillary lymphatic vessels also a content of this region. So three contents you have seen. One is axillary vein, another one is axillary artery, and the another thing is lymphatic vessels. Along with that, many yellow colored tubes you have seen, that is nothing but branches of brachial plexus. So along with this, some lymph nodes also will be seen. So to view the lymph nodes, we have to remove another muscle from here, that is deltoid. If you remove deltoid, you can make out in a clear image that we will be having some lymph nodes present in the axillary region. So in axillary region, we will be having some lymph nodes present. See, these are the lymph nodes seen. Okay, so the lymph nodes will be seen here also in axilla. That lymph nodes we will call as axillary lymph nodes. So along with the lymphatic vessels, we will be having axillary lymph nodes. I think you people will remember the lymph nodes which we seen in mammary gland. The mammary gland main lymph nodes what we studied is about axillary lymph nodes. Here also we will brush up through those topics. But for first, you have to remember we have major contents, four in number. One is axillary artery, another one is axillary vein. Then we will be having branches of brachial plexus along with lymphatic vessels and lymph nodes. And here we will be having some fat present. While you are dissecting, you can make out those are called as axillary fat. So these are the five important contents we are going to see in our topic. So we can move on to our topic details, that is axilla. So I think you people got oriented with this axillary region. Just you have to remember it is nothing but armpit and it is conically shaped. It have six parts such as anterior, posterior, medial and lateral wall along with apex and base. And the five contents you have to remember. The details of those things we will see now. Now we will look on to the details of axilla region. So about axilla, as I said before, it is nothing but armpit. We will call that as armpit region. And then it is a pyramidal shaped space between the upper part of the arm and the lateral thoracic wall. You can make out clearly in this picture. They have shown with a green color demarcation a truncated portion. That portion is called as axilla, where it is present between the armpit, so that is within the upper part of arm and the lateral thoracic wall. So that region will be called as axilla. Talking about the boundaries of this particular region, we will be having apex above, base below, and then we will be having four walls such as anterior, posterior, and then medial and lateral wall, as you can see that in the lower picture. So you can make out that clearly. So this region will be called as apex and this region will be called as base and this will be called as medial wall and lateral wall. Now in this picture you can make out apex and base clearly, and this will be medial wall, this is lateral wall, and this is anterior, and behind we will be having posterior wall. Now talking about boundaries, here also you can make it very clearly. So you can see three bones present here. One bone is present laterally, which we will call as humerus, and above another bone is seen. That bone is called as clavicle, and medially we will be having one bone which we will call as sternum with the articulation of costal ribs along with its cartilages. And then we will be having behind one bone that we will call as scapula with its process. So four bones you are seeing here. Between these only we are having this truncated part called axilla. I will repeat once again. Laterally humerus, medially sternum with the costal ribs and its cartilages, and then we will be having above clavicle, and posteriorly we will be having scapula with its processes. So above we have apex which is directed upwards, and below, that is directed downwards, we have base, and we will be having anterior wall which is covered by muscles. Same way we will be having posterior wall again covered with muscles, and we'll be having medial wall where costal ribs are arranged, and then we'll be having lateral wall which is related to the humerus part. That's all about the boundaries you have to remember. Now we will move on to each area separately. Talking about apex of the axilla. So that is the region which is directed upwards. This apex is again called as cervicoaxillary canal. The name itself it indicates cervico in the sense it is indicating a neck region. So cervical part. So neck region and the axillary region are involved in this part. So we are calling this canal as cervicoaxillary canal. You have to remember apex of axilla is otherwise known as cervicoaxillary canal. And then the boundaries of apex also will be seen clearly. So you can make out the boundaries. It is bounded anteriorly by clavicle, and behind it is bounded by scapula, and then it is bounded medially by first rib. So that's all about apex boundaries. The apex of the axilla is bounded anteriorly by clavicle, medially by first rib, laterally by the scapula. These are the boundaries of apex of the axilla. In this apex, what are the structures are going to transmit? Those are axillary vessels such as artery and vein, along with brachial plexus, and also long thoracic nerve, along with subclavian lymph trunk. All these structures are going to pass through this cervicoaxillary canal. And then for simpler way to make you ease with the diagram, consider this as an axillary region which is conical in shape, and it will be having apex upwards, and downwards we will be having base. Now we are talking about the boundaries of apex alone. So if you are taking the boundaries of apex, it is bounded by three ways, that is anterior, posterior and medial aspect. So you know this is axilla. In axilla, about apex we are going to talk. So again it is related medially with the first rib. So we will be having first rib related to the medial aspect of the particular boundary of axilla, that is apex of the axilla. Apex of the axilla is bounded medially by first rib. And now we have to talk about anterior wall. Anterior wall is formed by clavicle. As you already know, we have clavicle bone which is present in the upper part. So this is the bone which is going to form anterior wall of this apex of axilla. Now we will be having another bone which is bounded in the posterior aspect, and that bone is nothing but we have scapula which is present in the posterior most aspect. So scapula bone going to form posterior boundary for the apex of axilla, and this one you know it is anterior boundary which is formed by clavicle. Medial boundary is formed by first rib. So we have talked about apex of the axilla region. So this is apex of axilla. I think you people are clear with the boundaries of apex of axilla. Now we will move on to major part, that is remaining boundaries of the axilla, such as base and walls of the axilla. Talking about base of the axilla, it is directed downwards. As you can see in this picture, this is called as base of the axilla, and this base of the axilla, it is again bounded by some important structures. So before going into the boundaries of base, first you have to know it is directed below, and the boundaries, if you take, it is bounded anteriorly by anterior axillary fold, and posteriorly by posterior axillary fold, and medially by thoracic wall. That's all about the boundaries of base of the axilla. Base of axilla, it is directed downwards and is again bounded by three ways, that is anterior, posterior and medial aspect, same like apex of the axilla. Anteriorly it is bounded by a fold called anterior axillary fold. Posteriorly it is bounded by another fold called posterior axillary fold, and medially it is bounded by thoracic wall, that is nothing but lateral thoracic wall. And it is important feature is there, it is mainly formed by axillary fascia. Base of the axilla is formed by axillary fascia. Now you have to know what is axillary fold. We studied that it is bounded anteriorly and posteriorly by some axillary fold. What is axillary fold actually means? I think you people might be remembering the pectoralis major muscle. There we have seen to this, that is anterior axillary fold formed by pectoralis major. Same thing we are going to see now, that is anterior axillary fold which is formed mainly by lower border of pectoralis major. The lower part of pectoralis major, it is going to twist and then it is going to get inserted. The twisting nature or twisted lower border of pectoralis major going to form the anterior axillary fold in the base of axilla. Now going for posterior axillary fold, it is again formed by lower border of another muscle called latissimus dorsi, which is seen in the medial part of posterior axillary fold, and in the lateral part we are getting another muscle called teres major. So two muscles are going to contribute for posterior axillary fold. One is medially, another one is laterally. Medial most part by latissimus dorsi, lateral most part by teres major. But in case of anterior axillary fold, it is by only single muscle, that we will call as lower border of pectoralis major. It is as simple as that. We have only three boundaries for base also, such as anterior axillary fold, posterior axillary fold and medially by lateral thoracic wall. I think there is no necessary for any diagram, it is much simple for you to remember. Now we will go on for other walls of the axillar region. So if you take walls of axillar region, we have anterior wall first. So if we talk about anterior wall, anteriorly axilla is bounded by again the layers of the body. The layers will always start from skin. So anterior wall, it is bounded from above downwards by skin, superficial fascia, and then we will be having deep fascia called pectoral fascia. Then we will be having some muscle bounding this anterior wall, such as pectoralis major, pectoralis minor, subclavius, and along with this we will be having one fascia called clavipectoral fascia, and also another fascia called suspensory ligament of axilla, which is nothing but elongation of clavipectoral fascia itself. So about anterior wall, these are the important things you have to mention. Anterior wall of axilla is formed by skin, superficial fascia and pectoral fascia, along with the muscles such as pectoralis major, pectoralis minor, subclavius, clavipectoral fascia and suspensory ligament of axilla. In this picture also you can see clearly the muscles such as pectoralis major. Below pectoralis major we have pectoralis minor, and then below that we will be having some space which is having clavipectoral fascia also. I will show you in a simple diagram. Now you just understand. In cross section from above we are seeing that is, this is lateral aspect, this will be medial aspect, and this is posterior and this will be anterior aspect. In anterior, in this picture you can make out only two muscles such as pectoralis major and pectoralis minor. Now we will go for simplest diagram for this particular wall. About anterior wall relation we are going to see. So imagine this as axilla. If you have axilla, this will be called as anterior aspect. Just for imagination, anterior aspect, and this will be posterior aspect. So in the anterior wall, we will be having skin first. So we will be having skin. Then after we will be having superficial fascia. in the second layer. Later we'll be having pectoral fascia, which is going to cover the pectoral region, and then we'll be having important muscle which we will call as pectoralis major muscle. So we'll be having another muscle present in the fourth layer in the anterior wall that we will call as pectoralis major. Then again we will be having below pectoralis major two more muscle. One is present above and another one is present below. Okay, so above muscle we will call as subclavius. You already know above we have a bone. That bone will be called as clavicle, and just below the clavicle we will be having a muscle called subclavius, and below that we will be having another muscle that we will call as pectoralis minor. So this muscle, what we will call, it is nothing but subclavius. And another muscle what we seeing here is pectoralis minor. Okay, then we'll be having some fascia present in the region. Okay, that fascia will be nothing but clavipectoral fascia. So we have to show that also clearly. So clavipectoral fascia we have dealt already. So clavipectoral fascia, it is going to cover subclavius and also it is going to cover pectoralis minor. Later it is going to extend downwards as suspensory ligament of axilla and then going to converge with axillary fascia. So this is nothing but clavipectoral fascia, and this will be called as suspensory ligament of axilla, and this is axillary fascia over. Okay, so about these things you have to remember for our easy understanding. Now we will move on to posterior wall of the axilla. So in posterior wall of axilla, again it will be having some boundaries made up of muscles. Those muscles are nothing but the muscle gets attached to scapula. You know already we have a bone present in the posterior aspect of axilla, that is scapula. So the anterior surface of scapula, which is giving attachment to subscapularis muscle, is the muscle which is going to form the posterior wall. So posterior wall, it is formed mainly by subscapularis muscle, and then it is contributed by two other muscles such as latissimus dorsi and teres major. So posterior wall of the axilla is formed by three muscles such as subscapularis, teres major and latissimus dorsi. Now we will move on to next boundary, that is medial wall. So in this picture I think you people can orient, this is lateral aspect and this is medial aspect, anterior wall, posterior wall. Now we are going to see medial wall. So again in medial wall it is again bounded by a important muscle which we already discussed, the muscle called serratus anterior. The serratus anterior is a muscle which is going to form medial wall of axilla, which is again carrying a nerve for its own supply, that is long thoracic nerve. So long thoracic nerve along with serratus anterior will be forming major contribution for the medial wall of axilla. Along with this muscle we will be having upper 4 to 5 ribs along with its intercostal space, and its contents will be seen in the medial wall. So the things you have to remember is medial wall is formed by major serratus anterior muscle, and again along with that accessory relation in the medial wall are upper 4 to 5 ribs along with its intercostal space and its contents, forming the medial wall of the axilla region. Now we will move on to next boundary, that is lateral wall. So again you have to orient this carefully: medial, lateral, posterior and anterior. Now this is considered as lateral wall because we have humerus here. So this is a cut section of humerus, and here the lateral wall of axilla is formed by three important muscles passing through a sulcus present in the humerus. If you are thorough about bone, all these muscle attachments or muscle relations, whatever we are talking, will be much easier for you to understand. So be careful while reading bones, because bones will make a good base for you to study anatomy. So now we will move on to lateral wall. As I said before, humerus with its groove going to form the lateral wall. The groove or sulcus which we are seeing here is intertubercular sulcus. So this sulcus is going to transmit long head of biceps. So along with long head of biceps, we will be having other contributions formed by short head of biceps and thoracobrachialis, which are also going to contribute for lateral wall of axilla. That's all about the boundaries, which is very simple if you remember or if you have a good orientation about the axillary region. So what and all we have studied, I will just summarize now. We have seen axilla, where it is present, that is situation, along with its boundaries now. So if you take boundaries, we have 6 bounded areas, that is apex above, base below, and we will be having 4 walls such as anterior, posterior, medial and lateral wall. So about apex, what are the things you have to tell us? Again, apex of the axilla is bounded by 3 structures: medially, anteriorly and posteriorly. So those boundaries are anteriorly by clavicle, posteriorly by scapula and medially by first rib. Now we will move on to base. In base, again we will be having boundaries such as we will be having lateral thoracic wall in the medial aspect, and anteriorly we will be having muscles, and posteriorly we will be having scapula with its own muscle. So now we will go on to another important walls such as anterior wall of the axilla region. If you talk about anterior wall will be carrying again some important layers such as skin, superficial fascia, deep fascia, that is nothing but pectoral fascia, along with pectoralis major muscle, subclavius muscle and pectoralis minor muscle. And we will be having posterior wall formed by 3 muscles such as subscapularis, teres major and latissimus dorsi. Now we are moving to medial wall. In medial wall, it is formed by again serratus anterior along with upper 4 to 5 ribs with its intercostal space contents. Now we are seeing lateral wall. In lateral wall, 3 muscles are going to contribute. One is long head of biceps, another one is short head of biceps along with thoracobrachialis. So these structures will be seen much related or close to intertubercular sulcus, which was also to be mentioned while telling about lateral wall. That's all about the boundaries of axilla. Now we will move on to important thing, that is content of the axilla, which is very important for you for your exam purpose. So talking about contents of axilla, we have 5 important contents seen in this axillary region. Those are, first one, we will be having axillary artery with its branches. Then we will be having axillary vein with its tributaries. I think you may be clear. If it is artery, it will be having branches. If it is vein, it will be having tributaries. Always arteries are compared with trees and veins are compared with rivers for our easy remembrance. So always artery will give a branched appearance and veins will have all drainage from different parts. So we are calling it as tributaries. Then we will be having major nerve, that is brachial plexus with its cords and its branches. Then we will be having axillary lymph nodes and also axillary pad of fat, and sometimes we will be having axillary tail of breast also will be seen in this particular axilla region. So about these contents detailedly we will move on or see in the upcoming slides. So now coming for axillary artery. So axillary artery, it is an important or major artery seen in the upper limb. It is a continuation of subclavian artery. In the arterial system of the human body majorly comprised of heart, as you already know. From heart we will be having arch of aorta, which is giving some major branches, and from those branches we will be getting this axillary artery. So from the arch of aorta we are getting subclavian artery from the left side, and from the right side we will be having right brachiocephalic artery. From right brachiocephalic artery it is given right subclavian artery. I will explain all this to you in separate slide. Now you just remember, subclavian artery is the artery which is going to continue as axillary artery, and this axillary artery going to extend from the outer border of first rib. I think you can make out here. So here if you are seeing, you can make out this as the first rib. So from the first rib it is going to take its continuation from subclavian artery as axillary artery. Then after it is moving towards downwards, and then it is going to reach the lower border of teres major muscle, which you are seeing here. And after reaching the teres major muscle it is going to continue as another artery called brachial artery, because this region will be called as brachium, as you already know. So brachium with an artery we will call as brachial artery. Subclavian artery going to continue as axillary artery. Axillary artery in turn it itself going to continue as brachial artery. Extend from the outer border of first rib to the lower border of teres major muscle, and it is going to continue as brachial artery, and it is closely related with major vein and nerve, that is axillary vein and brachial plexus will be related close to this axillary artery. And this axillary artery, it is divided again into three parts for its branches, and it is easy for us if it is divided in this way. For our easy understanding about the branches of axillary artery, it is divided by means of a muscle called pectoralis minor, which we already know. We have a muscle in the pectoral region called pectoralis minor, which is responsible for dividing the axillary artery into three parts. So about the details of this axillary artery and its branches we will move on. So about talking about the branches of axillary artery, I said we have three parts formed by pectoralis minor muscle. So pectoralis minor, it is going to form three part of axillary artery. Among that, first part of axillary artery, it is starting from first outer border of first rib to the upper border of pectoralis minor muscle. You can make out a small part here. This part we will call as first part, and from this first part we will be having one branch arising. That branch we will call as superior thoracic artery. You have to remember in such a way, we have three parts in axillary artery, right? So these three parts will be having some branches. How it is arising is, from first part you remember we have only one branch. From the second part we have two branches, and from the third part of axillary artery we have three branches. So now talking about first part, we have one branch, that is superior thoracic artery. Now we will move on to second part. Second part you can make out here from the upper border till the lower border of pectoralis minor. This small part we will call as second part, which is hid out by this muscle. So pectoralis minor muscle, it is going to cover the second part of axillary artery, or you can tell it is underneath the pectoralis minor muscle, which we will call as second part of axillary artery. So again, this second part of axillary artery is going to give two branches. Among that, one we will call as thoracoacromial artery, and the next branches we have lateral thoracic artery. I think you people will be familiar with this artery because we have dealt this in mammary gland itself. Lateral thoracic artery is nothing but giving a major branch for mammary gland, that we will call as lateral mammary branch. So lateral mammary artery, a branch of lateral thoracic artery, is coming from this axillary artery's second part. Moving to third part, the remaining part from the lower border of or inferior border of pectoralis minor to the inferior border of teres major, we will call as third part of axillary artery. And this third part of axillary artery giving three branches. First one is subscapular artery, which is going to supply the subscapularis muscle, so it is given in such a name, subscapular artery. Next artery we will call as anterior circumflex humeral artery. Name itself it indicates it is going to reach the surgical neck of the humerus and it is going to wind around from anterior aspect. So we are calling that as anterior circumflex humeral artery. Next artery what we are going to see is posterior circumflex humeral artery, which is going behind the surgical neck of the humerus and going to anastomose with this anterior circumflex humeral artery. That's all about the branches you have to remember. You remember in such a way, we have three parts, and first part giving one branch, that is superior thoracic artery. Second part, two branches, one is thoracoacromial, another one is lateral thoracic artery. Third part with three branches, subscapular artery, anterior circumflex and posterior circumflex artery. Then we can see the branches name as we discussed before. So first part, second part arteries and third part arteries. That's all about the branches of axillary artery you have to remember. So for easy remembrance, I will show you a very simple diagram which is used by you people in exam purpose. Talking about axillary arteries, origin and its extent, we can make out a simple picture for our easy understanding, such as first you have to know how the artery is taking origin or how it is going to continue from another artery. First we have an important artery in our body, that is arch of aorta. From the arch of aorta we are having three important branches. One is right brachiocephalic, another one is left common carotid. Along with that we will be having left subclavian artery. Later this arch of aorta going to continue as descending thoracic aorta. So this will be called as descending thoracic aorta, and this is arch of aorta, and which is coming as a continuation of ascending aorta. Now we will talk about these branches. So as I said, this is right brachiocephalic artery, and this will be called as left common carotid artery, and this is left subclavian artery. So in this way it was arranged. Now we have to talk about subclavian artery. So left subclavian artery we got already. Now we have to see in right side also. In right side it is coming from right brachiocephalic artery, which is giving two branches. One is right subclavian artery and another one is right common carotid artery. Now we have to take only subclavian artery which is present on either side, which is responsible for the axillary artery. Now what will happen is this right subclavian artery, it is going to form a bend and it is going to continue as axillary artery. So right subclavian artery going to continue as axillary artery in the axilla region, which again going to continue as brachial artery. So we have three parts formed by this arch. So right subclavian artery seen in the head and neck region, and then we will be having axilla region with axillary artery, and then this axillary artery going to continue as brachial artery in the arm region. So this is considered as brachial artery, and the important part what we are going to learn now is axillary artery. So this is axillary artery, which is a continuation of right subclavian artery, and it again continues as brachial artery. Now we are going to see the important extent of the artery, that is axillary artery. This axillary artery extending from the outer border of first rib. So we will be having rib present medially. The outer border of the first rib going to give the extend level from above. Then after we will be having below extension till the teres major muscle. So we will be having teres major muscle with its upper border and the lower border. So this is upper border, this will be lower border. The lower border of teres major going to form lower extent or lower demarcation for this axillary artery. So this muscle we will call as teres major muscle. So this is teres major muscle which is going to form extend for the axillary artery, and below this lower border of teres major it is going to continue as brachial artery. That's all about the extent of axillary artery you have to know. Just you remember we have right subclavian or left subclavian artery going to continue as this axillary artery, and again this axillary artery going to continue as brachial artery in the brachium or arm region. Now we will see for its branches how it is arranged. Now talking about the axillary arteries branches, you have to know, just imagine this as axillary artery with its three parts. I have explained you now, it is extending from first rib to the lower border of teres major. And another thing you have to remember is it is covered in the small part or middle part by another muscle called pectoralis major. I think you people are familiar with this name. Pectoralis major is a muscle present covering the part of axillary artery. This muscle, it is going to be present above the axillary artery such that it is going to divide this artery into three parts. So we have first part, second part and third part of axillary artery. So three parts are there for axillary artery, first, second and third. First part extending from the outer border of first rib to the upper border of pectoralis major, and second border present just below the pectoralis major, this whole part. Third part, it is starting from the lower border of pectoralis major until the lower border of teres major muscle. So in such a way it is divided into three parts. Now talking about branches, first part of axillary artery, first part of axillary artery, it is giving branch to only one artery, that is superior thoracic artery. So we have superior thoracic artery which is a branch from first part of axillary artery, superior thoracic artery. So this whole thing is axillary artery, first part giving only one branch, that is superior thoracic artery. Now we have second part, it is giving origin for two arteries or two branches, such as one branch, that is upper branch, we will call as thoracoacromial artery. This thoracoacromial artery, it will be having a small trunk and it is giving four branches. About those details I will explain you later. Now you just remember second part of axillary artery which is present below the pectoralis minor. It is arising as a small trunk and giving four important branches which we will call as thoracoacromial artery. So we are calling this as thoracoacromial artery. Then we will be having another artery arising that we will call as lateral thoracic artery. So we have another branch arising, we can call that as lateral thoracic artery. And this lateral thoracic artery is a artery which is going to supply the lateral part of mammary gland, which you people are familiar with. Now we will go on to third part of axillary artery. So in third part, you already know we have three branches. So one branch is subscapular artery. So we have a branch coming and supplying the posterior aspect. So we are calling this as subscapular because of its supply to the particular muscle, subscapular artery. Then we will be having two more arteries which is going to the lateral aspect. One is to the surgical neck. In the anterior aspect we will call as anterior circumflex humeral artery. We will be having anterior circumflex humeral artery in the anterior aspect of surgical neck, and again we will be having in posterior aspect another artery which is going to anastomose with this anterior circumflex artery. We will call that as posterior circumflex humeral artery. So these are the arterial branches given by axillary artery, you have to remember. So that's all about axillary artery and its branches detail. We will move on to other importance of these branches now. Now we can see in or move into the details of branches of the axillary artery. As I said before, axillary artery's first part, it is giving one artery, that is, or one branch we will call as superior thoracic artery. You can view clearly in this picture. So this is superior thoracic artery coming from first part of the axillary artery, and this superior thoracic artery, it is the first branch to arise from the axillary artery, and it is going to be coming from first part of the axillary artery. And how it is passing or course of this artery is, it runs along the upper border of pectoralis minor. So it is above the pectoralis minor, it is passing along the upper border of pectoralis minor muscle. Later, it is going to anastomose with internal thoracic and upper intercostal arteries. At last, it is going to terminate by anastomosing with internal thoracic and upper intercostal arteries. That's all about superior thoracic artery. Now we will move on to thoracoacromial artery, which is a branch arising from the second part of axillary artery. And coming from the second part of axillary artery, it is going to pierce the fascia called clavipectoral fascia, which we dealt earlier. Clavipectoral fascia is pierced by four important structures such as lateral pectoral nerve, cephalic vein, thoracoacromial vessels, along with lymphatics. So among that, one structure is thoracoacromial artery, and this is going to pierce the fascia, and after piercing the fascia, it is going to divide into four terminal branches, that are pectoral branch, acromial branch, clavicular branch, and deltoid branch. So it is passing medially, anteriorly, laterally, and also above. So these are the branches given by thoracoacromial artery. And you can see in this picture clearly, you have deltopectoral groove, that is between the deltoid muscle. This is deltoid muscle, this is the lower border of deltoid muscle, and this is pectoralis major muscle. This is the upper border of pectoralis major, and then we will be having here a space. So this space is called as deltopectoral groove. So in this groove we will be having a fascia, a wide thickening you can make out. That fascia we will call as clavipectoral fascia. So in this fascia we will be having one artery piercing and coming out. That artery we will call as thoracoacromial artery, and it is giving branch such as pectoral branch, and here we have deltoid branch, and then we will be having clavicular branch, along with we will be having another branch called acromial branch, which is going behind. In this picture it is not clear, just you remember we will be having four branches anteriorly, pectoral, and we will be having acromial branch behind, and then laterally or superiorly we will be having deltoid branch. Below we will be having another branch for clavicle. So that is clavicular branch of thoracoacromial artery. Now we will move on to another artery, that is third artery coming from second part of axillary artery, that is lateral thoracic artery. About lateral thoracic artery we have dealt before, that is lateral thoracic artery, it is going to give a branch called lateral mammary branch, which is going to supply most of the lateral part of mammary gland. And this lateral thoracic artery, it is arising from second part, as you all know, and it is going to accompany the lower border of pectoralis minor muscle, and it is related closely to anterior group of axillary lymph nodes. About axillary lymph nodes, we have 5 in number. Among that, anterior axillary lymph nodes is related to this artery. In females, as we already know, it gives a large lateral mammary branch to supply the mammary gland. And that's all about the first part and second part branches. Now we can move on to subscapular artery, an artery arising from the third part of axillary artery. And this subscapular artery is the largest branch which is arising from third part. Then we will be having the course of the subscapular artery is it is going to run along the lower border of subscapularis muscle, and then it is going to reach the inferior angle of scapula. After reaching the inferior angle of scapula, it is going to anastomose with three arteries such as lateral thoracic, intercostal, and transverse cervical artery. Then after it is gives a branch called circumflex scapular artery, which is going to appear in upper triangular spaces we will deal later. Just to remember, we have a space called upper triangular space. There we will be having a branch called circumflex scapular artery, which is nothing but again a branch of subscapular artery. So about subscapular artery, you have to tell from where it is originating and the course of the artery, how it is anastomosing, and what branch it is giving. Now we can move on to another artery. Before that, in this picture you can make out subscapular artery really clear. So here we can make out an artery such as, see here. So this is subscapular artery, which is giving a branch called circumflex scapular artery. Around here we will be having one triangular space, which we will deal later. That space is responsible for upper triangular space. Okay. Now we can move on to next artery in third part, that is anterior circumflex humeral artery. So name itself indicates it is present anteriorly to the neck of the humerus and it is going to wind around, so we are calling it as anterior circumflex humeral artery. So it is a branch from third part and it is related to surgical neck of humerus, going to anastomose with an artery called posterior circumflex humeral artery, which is again a branch of third part of axillary artery, and then it is going to give a ascending branch which is going to supply a joint called shoulder joint, and then it is going to supply humerus itself. That's all about anterior. Now we will move on to posterior circumflex humeral artery. So same, it is arising from third part of axillary artery and it is going to enter a space called quadrangular space. Later, after entering the quadrangular space, it is going to anastomose with anterior circumflex humeral artery, which is present behind the surgical neck of humerus. After anastomosing, it is also giving a branch which is descending branch. That descending branch is going to anastomose with ascending branch of profunda brachii artery. This profunda brachii artery is a branch of brachial artery, which is again a continuation of axillary artery. So about the details of those arteries we will deal later. Now you just remember how posterior circumflex is getting terminated. It is terminating by means of forming an anastomosis by its branch with the profunda brachii arteries branch. So that's all about axillary artery and its branches. Now we will move on to the relation. So in our human body, we will see the relation in such a way. Axillary artery will be seen laterally and medial to axillary artery we will be having this vein called axillary vein, and this artery, it is surrounded by the brachial plexus nerves. So the relation of these structures we will deal now, and that we will again divide into first part, second part and third part, how it is related and what are the important structures are related surrounding this axillary artery with a simple picture. Now we are going to see the relations of or relationship of axillary artery with other structures such as vein, muscles and nerves. So here we are dividing the axillary artery into three parts as you are seeing in this diagram. So consider this as the first part of axillary artery, this as second part of axillary artery, and this will be third part of axillary artery. And for orientation, you remember this as anterior aspect, and behind we have this as posterior aspect, and this as medial, and this as lateral aspect. So if you have this orientation, then it will be easier for you to remember the structures. So as you already know, this red color tube area, the cut section, we will remember as axillary artery. So this is axillary artery. And then we have anterior relation, posterior relation, and this will be lateral relation, and this is medial relation. First we will concentrate only on first part of the axillary artery. So in first part, anterior relations are first layer, From anterior to posterior we will go. Anteriorly, first layer will be skin will be seen. Then we will be having next layer or second layer as superficial fascia, and third layer you can see a green coloration, that is nothing but deep fascia or pectoral fascia of upper limb. Then we will be having a muscle layer, that is nothing but pectoralis major muscle. And below pectoralis major, what muscle will see? You already know, that is nothing but pectoralis minor muscle. All these things you yourself you can make out because of the before classes what we had seen. So same thing from anterior to posterior. In the anterior wall of axillary artery, in first part we have these layers, and here you can see two nerves, that is nothing but pectoral nerves. One is medial pectoral, another one is lateral pectoral nerve. So we have pectoral nerves related to in the anterior wall of axillary artery. So pectoral nerve, that is medial and lateral. Then we will move on to posterior relation. In posterior relation, you can see a muscle here, that is nothing but serratus anterior. So serratus anterior is a muscle which is seen in the posterior wall or posterior aspect of the first part of axillary artery, along with the cord of brachial plexus. So in brachial plexus, we will see later, brachial plexus we will be having three cords such as medial cord, lateral cord and posterior cord. In the first part, posteriorly, the cord you are seeing is medial cord of brachial plexus. Medial cord of brachial plexus will be seen in the posterior aspect of first part of axillary artery. So along with serratus anterior, a nerve is seen. What you believe it will be? Yeah, you are right. This is nothing but long thoracic nerve, which is going to supply this particular muscle. So anterior wall and posterior wall relations got over for first part of axillary artery. Now we will move on to medial aspect. It is very easier. You remember, for axillary artery in all the three parts we have medial relation as axillary vein. Right. So we have axillary vein as the medial relation for axillary artery. Now we will move on to lateral relation. You can see two more thickened nerve, that is nothing but cords. So medial cord you've seen in posterior aspect. Now in lateral aspect you will see posterior cord of brachial plexus along with lateral cord of brachial plexus. Over. That's all about the relations surrounding the axillary arteries first part. So I think you people are clear. To sum up, I will explain again. In anterior wall in anterior aspect you will be having skin, superficial fascia, pectoral fascia, along with pectoralis major muscle and minor muscle. Along with this you will be having two nerves, medial and lateral pectoral nerve, which is going to form a loop there. Now we will be having posterior aspect relation as one muscle, that is serratus anterior with its nerve supply long thoracic nerve, and you will be having one cord present there, that is medial cord of brachial plexus. Now we will move on to medial relation. As I said before, for axillary artery in all the three parts we have one relation, that is axillary vein. Moving to lateral part, in the lateral aspect we will be having two cords of brachial plexus, such as lateral cord and posterior cord of brachial plexus. I think it is clear to you. Now we will move on to second part of axillary artery. So in second part of axillary artery, same when compared to anterior aspect. Anterior aspect, it is very easier. Same way we will be having skin. Then we will be having superficial fascia. Third layer will be deep fascia along with pectoralis major and minor. Over. That's all about anterior aspect or anterior relation of axillary artery. Now we will move on to posterior relation. The muscle what you are seeing in the second part in the posterior wall is nothing but subscapularis. We will be having subscapularis muscle related in the posterior aspect of second part of axillary artery. Then along with that you can see a thickened cord present in the posterior aspect, that is nothing but posterior cord of brachial plexus. Here you should remember, in second part posterior cord of brachial plexus is seen in the posterior aspect. So now in the about the anterior wall and or anterior relation and posterior relation of axillary artery and its a relation will be clear to you. Now we will move on to medial relation of second part of axillary artery. In the medial relation of second part of axillary artery, you can make out axillary vein, that you already know because it is the vein which is seen in all the three parts of axillary artery related medially. Along with axillary vein, you can see another cord of nerve. Okay, so that is nothing but medial cord of brachial plexus, the same cord we had seen in first part in the posterior aspect. So it is rotating, you can make out medial cord from posterior, it is coming medially and the posterior cord is coming posteriorly. That is what happening in the second part. Second part is very easy to remember. We have posteriorly posterior cord of brachial plexus, medially medial cord of brachial plexus. So obviously in the lateral part we will be having lateral cord of brachial plexus. That's it. So that's all about the first part and second part axillary artery and its relations, where anterior, posterior, medial and lateral relations got over. Now we will move on to third part of axillary artery. So this third part, that is terminal part, which is going to continue as brachial artery, is again related, but here you have to remember cords will not be seen. The brachial plexus branches will be seen. The brachial plexus will be having roots, trunks, cords and branches. The terminal part of brachial plexus is giving the branches. So those branches will be seen related to this axillary artery of third part. Now we will get into it. So same in anterior wall, same relation as like first and second part. First layer will be skin and the second layer will be superficial fascia. Third layer will be deep fascia. Fourth, pectoralis major, and fifth will be pectoralis minor. So that's it about anterior relation. Coming for posterior relation, we will be having same muscle from second part, that is subscapularis muscle. And in front of that you will be having two muscles. One will be called as teres major. And another muscle what you are seeing will be latissimus dorsi. So these are the three muscles related in the posterior aspect of the axillary artery's third part. Now we will move on to other nerves present here. In the posterior aspect you can see two nerves present here. One is nothing but axillary nerve. One nerve what you are seeing in posterior relation of third part is axillary nerve, and another nerve is radial nerve. So in the posterior relation of third part we are having two nerves, one is axillary nerve, another one is radial nerve. Same way coming for medial relation. In medial relation you already know we have axillary vein, and here you have to remember two other structures also related medially. One is medial cutaneous nerve of forearm. So this nerve is nothing but medial cutaneous nerve of forearm. Medial cutaneous nerve of forearm, which is present between axillary artery and the axillary vein. And then medial to axillary vein, again you can make out another nerve, that is nothing but medial cutaneous nerve of arm. So this is a very important relation in finding out brachial plexus in your practical purpose. That time they will ask for these two nerves, which is very important, and that time you have to trace between the axillary artery and axillary vein as medial cutaneous nerve of forearm and medial to axillary vein as medial cutaneous nerve of arm. That's all about medial relation of third part of axillary artery. Now we will move on to lateral relation. In lateral part we can make out one muscle present here. So the muscle which is seen here is nothing but thoracoacromial brachialis. So it is somewhat extending towards the brachium. So we have this muscle called coracobrachialis, and this muscle is pierced by one nerve called musculocutaneous nerve. So the nerve you are seeing here is musculocutaneous nerve, and another nerve what you are seeing here which is present laterally is nothing but median nerve, which is a very important nerve in upper limb. So median nerve is related lateral to the third part of axillary artery. That's it about the relations of axillary artery. Axillary artery is a very important question for you people. So while explaining axillary artery, you have to tell about its extent and how it is passing. Along with that, you have to explain the relations such as three parts: first part, second part, and third part, as shown in this diagrams. And whichever diagram is easy for you, you can follow that. And this diagram is used, I have to show you in a simpler way. So in that way, in that sense, I have shown this diagram. And then you have to explain about the branches, and each branches separately you have to mention. That's it about axillary artery. Now we can move on to next topic called axillary vein. So now we will move on to our next topic called axillary vein. So I think you people are clear with axillary artery and the other contents, other boundaries about axilla. Now we will move on to one more important content which is present in the axillary region, that is axillary vein. So always you remember some major arteries are always accompanied by its corresponding veins. So axillary artery is also in such case it is accompanied by a vein called axillary vein. The veins are drain from downwards to upwards. So we will be having from above downward the arterial course. From below upward we will be having venous course, because it is going to drain its content into some other important vein. So we have this vein which is arising from the lower part and getting drained into the upper part. So in upper limb, the major vein which we are going to see now is axillary vein, which is accompanying the axillary artery. So about axillary vein. Axillary vein, again it is going to extend from the lower border of teres major to the outer border of first rib, but from below upwards. It is a continuation of basilic vein, or sometimes it may be a union of basilic vein with venae committens of the brachial artery. You will study about this later. Just you remember for now, the brachial artery will be seen in the arm region, which again accompanied by two veins on its either side. So that veins we will call as venae committens. This venae committens along with basilic vein unite together in some cases, but actually in most of the cases it is a continuation of basilic vein itself, and it is going to continue from the lower border of teres major. In this picture you can make out that clearly. So here you can see basilic vein. So this is the basilic vein which is arising and coming upwards, reaching the lower border of teres major muscle. Later it is going to continue as axillary vein. So this is axillary vein which is again covered by pectoralis minor muscle in the middle part. Later it is going to reach the outer border of first rib, and then here we will call that as subclavian vein. So it is going to continue again as subclavian vein that we are going to see. So ends at the outer border of first rib and it is continuing as subclavian vein. Axillary vein, it is a continuation of basilic vein. At last it is going to reach the outer border of first rib, and from there it is going to continue as subclavian vein. That's it. Now we are going to move on tributaries of this particular vein. We have branches for arteries, and for vein we have tributaries, as I said before. So tributary of axillary vein are, first one is cephalic vein. You already know in anatomical position, laterally cephalic vein will be seen in the lateral side of upper limb, especially in the arm and forearm region, and medially we will be having in arm and forearm region basilic vein. So this cephalic vein, it is going to drain in the axillary vein, and also the veins which correspond with the branches of axillary artery, that is axillary artery branches such as superior thoracic, lateral thoracic and other arteries again accompanied with its corresponding veins, and those corresponding veins are going to drain again in this axillary vein. That's all about axillary vein you have to know. So I believe axillary artery and vein are clear to you. Now we will move on to its applied aspect about these axillary vessels. About axillary vessels, first we are going to talk about the part of vein which is present in front of first part of axillary artery. The vein, if it got compressed by subclavius muscle, we know in pectoral region we have a muscle just below the clavicle, we will call that as subclavius muscle, and during abduction this muscle, some cases it will compress the vein which is present in front or in frontomedial with the axillary artery. This may account to axillary vein thrombosis. A clot will be happening. So axillary vein thrombosis is a condition found in case where subclavius muscle got compressed the axillary vein which is present above the first part of axillary artery, and when the arm is held in prolonged abduction above the head, that is during painting or sealing, this condition is most common to occur. So the painters will be having this condition in most cases. Then we will be having another condition called axillary arch. Arch, it is an muscular band connecting two muscles such as latissimus dorsi and pectoralis major. This arch, if present, it may compress axillary vessels. So axillary artery can be compressed against humerus and stop bleeding from the distal part injuries. So this is the condition which will happen during the axillary arch presence. So axillary artery can be compressed against humerus to stop bleeding from the distal part injuries. So these are the conditions happening in axillary vessels. Now we will orient how the axillary artery and vein are related in a 3D view. Now we are going to see about the 3D view of axilla contents, especially axillary artery and axillary vein. So in this image you can make out how it is oriented. Now you can see the removal of pectoralis major which is present above in the pectoral region. So you can see the pectoralis minor muscle clearly. Later we have removed some other muscles such as we have deltoid muscle present here, that is also removed. Now for clear view we have to remove another muscle called biceps brachii also. So if you remove all these muscles, then it will be easy for us to undergo or see the structures present in the axilla. As you already know, axilla is a region present between upper part of arm and the lateral thoracic wall. So here just below the pectoralis minor you can see this three coloration, that is one will be nerve formed by brachial plexus, and then we will be having one red color tube, that is artery, and blue color tube will be called as vein. Now we will see these structures separately. First we will view into axillary artery. So while talking about axillary artery, first we have to remove pectoralis minor muscle. So once you remove pectoralis minor muscle, then it will be clear to see all the three structures clearly. So we can make out that now. So here if you see in the axilla region, you can make out vein, artery and the branches of brachial plexus. Here in the upper part, that is in the neck region, you have a loop like tube, that is nothing but subclavian artery. So this subclavian artery is the artery which is going to continue as axillary artery. So subclavian artery, it is reaching the outer border of first rib, then after it is going to continue as axillary artery. Now you can see this clearly, the colored change from the artery, that we will call as axillary artery. To view that clear, we have to remove vein also. So we will see about that by removing the vein. So we can remove the axillary vein now. So once you remove the axillary vein, Now you can see the axillary artery clearly. All the branches of axillary vein, everything if we remove, then it will be better for us to see the details of axillary artery. So this axillary artery, again it is winded round and it is surrounded by some nerve plexuses, that is nothing but branches of brachial plexus. And here you can make out one loop present in front of the axillary artery, that is nothing but loop formed by median nerve. So then now we will remove those nerve structures also, which we will do later detailing. So we can remove all these structures. Now we will concentrate only on the arterial part, that is axillary artery. So as I said before, the extent is from outer border of first rib till the lower border of teres major muscle. You can make out a muscle here. So lower border of teres major will be the terminal extent of the axillary artery. So we are dividing this axillary artery again into three parts. As I said before, we will be having a muscle present here. That muscle is going to divide this artery into three parts. Now talking about first part of this axillary artery. So from the first part of axillary artery, we will be having another one artery arising, that is right superior thoracic artery. So this is right axillary artery. So we will be having one artery arising from that, we will call as superior thoracic artery, which is the first branch from the first part of axillary artery. To brush up, you can remember first part it is giving one branch, second part two branch, and third part three branches are given. First part, one artery is superior thoracic artery, which is what we are seeing now. Then we will be having second part somewhat here. So in second part we will be having two arteries arising. One is thoracoacromial artery. So this thoracoacromial artery will be having a small trunk. Later it is going to divide into four branches, as you can see here. One branch which is going towards behind, which we will call as acromial branch, to supply the acromial process near to the shoulder joint. The process is coming from scapula. So acromial branch of thoracoacromial artery. And another branch what you are seeing here is we will be having deltoid branch of thoracoacromial artery, which is going to supply the deltoid muscle, which we have already removed. Then we will be having other branches such as pectoral branch. So here you can see a branch, that is pectoral branch of thoracoacromial artery. And one more branch will be seen here to supply the clavicle part. As clavicle we remove, that time the artery is also removed. So we will be having another branch arising from this thoracoacromial artery, that is clavicular branch. So thoracoacromial artery it is giving four branches and it is arising from second part of axillary artery. Now we will move on to next branch coming from this second part, that is lateral thoracic artery. So this artery you can see clearly, it is having a vertical course and it is going to reach the lateral thoracic wall, and here it is from this part it is going to supply the lateral part of mammary gland. So we are giving a special name for this, that is lateral mammary branches. So lateral mammary branch of lateral thoracic artery is very important for supply to mammary gland. And that's all about second part of axillary artery and its branches. Now we will move on to third part. So this whole thing will be called as third part of axillary artery. So in third part, as you already know, we have three branches arising from third part. So those three branches are namely subscapular artery, anterior circumflex artery, and posterior circumflex artery. So here in this picture you can make out those two arteries which I said last, that are circumflex arteries. So here this is humerus and this will be called as surgical neck. So in surgical neck anteriorly one branch is passing coming from the third part of axillary artery, and this we will call as anterior circumflex artery. Same way if you go behind we will be having another artery present. So that is posterior circumflex humeral artery. Here you can make out clearly. So this is posterior circumflex humeral artery and this is anterior circumflex humeral artery, which are branches of this axillary artery. So that's all about the axillary artery course and its branches. So now we will move on to the view of axillary vein and how it is going to terminate or drain into subclavian vein we are about to see. So in this image we are going to see axillary vein. Here, after removing the pectoralis minor muscle, you can make out the vein which is present anteriorly or superficially. So to see it in better view, we are going to remove biceps brachii also. So I think now it is clear for you to see. So we are removing another muscle present here. Now it is better for us to see the axillary vein and its relations clearly. So this is the axillary vein which is starting from the outer border of first strip. It is coming from the lower border of teres major muscle, and then this is teres major, and from the teres major it is going to extend upwards. Later it is going to reach the outer border of first rib. So this whole thing we will call as axillary vein. This axillary vein again will be having some drainage coming from or veins coming from other parts surrounding it. All those veins are nothing but tributaries corresponding with the axillary artery. So all these tributaries or these small veins such as superior thoracic vein, lateral thoracic vein, thoracoacromial and humeral veins, all these veins are going to drain up in axillary vein. To know about axillary vein, actually it is a continuation of basilic vein. Here you can make out a vein. So this vein is nothing but basilic vein. In anatomical position, it is seen in the medial aspect. So in the medial aspect, we will be having basilic vein which is coming from the hand, reaching the forearm, and then coming upwards, reaching the arm. Later in axillary region, that is above the lower border of teres major, it is going to continue as axillary vein, and this axillary vein at last going to continue as subclavian vein. So this subclavian vein, it is present outside the lower border or outer border of first rib. That's all about the extent of axillary vein with its tributaries you have to remember. So axillary artery and the axillary vein are clear to you, I believe. Now we will move on to other important structures present in the axilla region. Other than axillary artery and axillary vein, we will be having another important structure called as brachial plexus. So after artery and vein, we will be dealing with nerve, and about this brachial plexus we will deal later detailedly because it is a very important topic for you people for your exam purpose. Now we will just look on to its importance. This brachial plexus, again, it is formed by some cervical roots and one thoracic root. So it is a main nerve which is going to supply the upper limb, and it is formed by the union of ventral rami of lower fourth cervical and also first thoracic nerve. So we will be having C5, C6, C7 and C8 nerve roots along with T1 nerve root going to form this brachial plexus, and it consists of roots, trunks, division and cords in its course. Brachial plexus, it will be having 4 parts such as roots, trunks, divisions and cords, which we are going to deal about this detailedly with its branches also. So you can make out the brachial plexus clearly in this image which is present in the axilla part, and it is taking its origin from the neck region or cervical region, reaching the neck whole course and then reaching the axilla, and again it will extend till arm, forearm and hand by its branches. Now we will move on to next important content, that is axillary lymph nodes. So lymph nodes are present or arranged in our upper limb region, mainly in axilla. As we studied before in mammary gland itself, it is very easy for us to remember these things detailedly now. So axillary lymph nodes, major content of axilla, again will be having 20 to 30 in number. So axillary nodes together will be 20 to 30 in number and drains the lymphatics from upper limb and most of the mammary gland, as we know already, and cutaneous lymphatics from the trunk above the level of umbilicus. Along with that, it is going to be get divided into 5 groups such as anterior, posterior, lateral, central and apical. And then we will be having the arrangement in such a way like this. So central, and second one is lateral, third one pectoral or anterior, fourth is apical, and fifth will be called as subscapular or posterior axillary lymph nodes. Now we will move on to anterior group of axillary lymph nodes. About anterior group, it is going to lie along the lateral thoracic vein. You have to remember this. Usually lymph nodes will be seen near or close to the veins present near to its location. So same way, anterior axillary lymph nodes is present near to lateral thoracic vein, and it is related to the lower border of pectoralis minor muscle. It is going to drain most of the lymphatics from mammary gland, and it is going to be in contact with axillary tail of spines, and it again gets drained into central and apical group of lymph nodes. So these are the afferents coming from mammary gland, and again after draining into this anterior lymph nodes, again efferents are going to get drained from this anterior axillary lymph node to apical and central part. Then the carcinoma of this part will be always misdiagnosed as enlarged lymph node. It is a clinical condition, you have to remember. So usually carcinoma, if happening in this node, will be always mistaken as an enlarged lymph node. Now going for posterior group, that is subscapular lymph nodes. So this posterior group again will be lie along with the subscapular vessels in the posterior wall of axilla. Anterior one, it is lying along with lateral thoracic vein. Here it is lying with subscapular vessels, and it is going to receive its afferents from iliac crest. So it is going to receive from whole of the trunk till the iliac crest, and at last it is going to pour out its content into apical and central group as like anterior lymph nodes. So after the anterior and posterior group of axillary lymph nodes, now we are going to deal with lateral group of axillary lymph nodes. In lateral group, these nodes are going to be located near to axillary vein. So as I already said, all these lymph nodes are related with the venous system. So we will be having axillary vein. In the posteromedial aspect of this vein, we have this lateral group of axillary lymph nodes, and this is going to drain entire upper limb except the lymphatics, which is going to accompany the cephalic vein. You can make out clearly in this picture that lateral group is present related to axillary vein, and then we'll be having other lymphatics or lymph nodes such as apical and central group. As we have already seen, many of these other axillary lymph nodes such as anterior, posterior and lateral are at last going to drain in central and apical. So these two lymph nodes are again an important part. So now we can deal with that central group. So central group of axillary lymph nodes, it is again will be present close to the base of axilla, and it is going to receive afferents from all anterior, posterior and lateral group of axillary lymph nodes. And from here, where it is going to drain, it is obviously going to drain in apical group. So apical group of axillary lymph nodes is the major terminal center for all other lymph nodes to get drained, and then this is going to be present. These nodes are going to traverse intercostobrachial nerve. This is a nerve which is going to pass between these nodes. So intercostobrachial nerve, about its importance and all we will learn later. Just to remember, the central group will be giving one passage for a nerve called intercostobrachial nerve, and then it is going to cause acute pain on inner arm. If it is got enlarged, it is going to form acute pain in the inner arm. That's all about the central group, and you can make out in this picture, this is the central group of axillary lymph nodes which is present in the base of axilla. Now we can move on to apical group. Talking about apical group, in this picture you can make out it is present at the apex of axilla, and it is medial to the axillary vein, and it is going to be divided into afferent and different groups. Afferent groups are going to get from afferent vessels are coming from subcutaneous lymphatics of upper limb, which is going to accompany cephalic vein, and also from upper margin of mammary gland, and some other groups of axillary lymph nodes such as central, anterior, posterior and also from lateral group of lymph nodes everything are going to get drained in this axillary lymph node. And from the apical group, again where it is passing, it is again going to get drained in jugular lymph trunk and also thoracic duct, and also it is going to contribute for formation of brachiocephalic vein. So in the formation of brachiocephalic vein also we will be having this drainage along with jugular lymph trunk and also thoracic duct. That's all about apical group of axillary lymph nodes. So axillary lymph nodes, again they can ask for you in your exams like in 3 marks or 5 marks and all. So be thorough with this axillary lymph nodes, about all its parts and how it is grouped together and what are the efferent and afferent vessels passing, at last how it is terminating. Now we can move on to the picture where schematically it is given how it is related. So apical, it is present on the apex, and below that we have central, and anteriorly we have pectoral nodes which is related to lower margin of pectoralis minor, and behind we will be having posterior which we will call as subscapular, and laterally we will be having humeral or lateral nodes which is related near to the humerus. And then we will talk about some applied aspects. So about applied aspect of axillary lymph nodes, major thing is apical group. You know, all the lymph nodes are getting drained in apical group. So this group acts as a terminal lymphatic barrier for the upper limb and also for mammary gland during enlargement due to infection and metastasis. This is the node where we will palpate. So palpation of apical group is used for seeing whether the enlargement in the or metastasis have been seen in upper limb, that is in upper limb or in mammary gland, will be easily identified by palpating in the apical group of axillary lymph nodes. And then we will be having another important node called rotor's node. It is a node which is seen between the pectoralis major and minor muscle. And now we will classify the same lymph nodes for our easy identification. Especially it is used by clinicians for easily identifying the lymph nodes present in the axilla. So we are dividing this into 3 levels on relation with pectoralis minor muscle. First, at level 1 we have low nodes such as anterior, posterior and lateral, which are located below and lateral to the lower border of the pectoralis minor muscle. At level 2, that is middle node, it is seen central just behind the muscle, that is just behind the pectoralis minor muscle. At level 3 it is seen in the apical part, that is apical lymph nodes are seen just above the pectoralis minor muscle. Among this, level 1 is the first to get enlarged in cancer of breast, followed by second and third. So level 1 is the place where we will palpate and find out whether the cancer cells are accumulated, and then from there only it is going to get spread at level 2 and level 3 level. So we will go for applied aspects of axilla now. So altogether we have finished about contents of axilla. Now we are going to see some clinical aspect related to this whole of the axilla region. So infection of hair follicles and sebaceous cysts may happen in axilla region. And then we will be having some type called abscesses, that is suppuration, where pus points at anterior axillary fold or deltopectoral groove surround the neurovascular bundle and then it will ascend up. So these are the 2 important things you have to remember for clinical aspect of axilla. And then to open a deep axillary abscess, if axillary abscess is present and it is present deep, we have to approach in such a way the knife should be placed at the base of the axilla, that is midway between the anterior and posterior axillary fold and more towards the thoracic wall, which is again going to avoid injury to the lateral thoracic, subscapular and axillary vessels in the anterior, posterior and lateral wall of the axilla respectively. So we are going to approach the deep axillary abscess. We have to be clear we are going through the midway between 2 axillary folds, because to avoid the major vessels related to that region. So that's all about the axilla region. I believe you people are clear with this topic. So in axilla, to summarize, we have to know about the situation where it is present, and you have to talk about boundaries. Then we will be having each boundaries relations, and then we are going to approach its contents, and contents 5 in number. About all the 5 contents you have to explain whatever you know. And axillary artery, it is a very important topic you have to remember with its relation. And as same like that, we have axillary vein, axillary lymph nodes, along with brachial plexus. And about brachial plexus we will deal detailedly, which is again a very important question seen in exam papers usually. And other clinical aspects and all, you have to be thorough with it. So thank you for listening.